A tunnel is created across the conjunctiva, anterior sclera, limbus, and adjacent cornea. Rhexis is done under viscoelastic. The nucleus epinucleus mass is rotated so that it's completely separated from the peripheral cortex. The loose cortex in front of the epinucleus is aspirated with a Simcoe cannula. The tunnel is small and the lens needs to be bisected before it's taken out safely without endangering the endothelium and the tunnel. AC is filled with viscoelastic. It's not very tense anterior chamber. The nucleus epinucleus is pulled down using the cystotome. It's hooked by a ball dialer, and the nucleus is bisected using the cystotome with the dialer offering the counter pressure. The heminuclei are now prolapsed into the anterior chamber and is guided out, sandwiched between a mini wire vectis and the infusing 25 gauge cannula. 25 gauge cannula is attached to a syringe which continuously injects viscoelastic in front of the moving nucleus epinucleus mass. Similarly, other half of the nucleus epinucleus mass is removed from the anterior chamber through the tunnel. It's a low pressure technique. The fluidics is very low. The pressure inside the eye at this time is anywhere between atmospheric pressure and the normal intraocular pressure, so there is no bowing backwards of the posterior capsule. The anterior chamber is maintained by continuous irrigation with the Simcoe cannula with visual feedback. The cortex is aspirated. A prior hydrodissection will facilitate the aspiration of cortex from the capsular bag, and at the end of cortical aspiration, the intraocular lens is implanted into the capsular bag. As there is no side port, subincisional cortex needs to be removed by left and right Simcoe cannula, J-shaped cannulas, and this tunnel, which is a little longer than the Phaco tunnel and little wider than the Phaco tunnel, is absolutely foolproof, and it does not cause more than 0.5 or 0.6 diopters of SIA, and more than that there is no need to hydrate or close the tunnel, as the tunnel is not stretched during surgery. The heat of phacoemulsifying probe is not there coagulating the collagen, and non-stretch and non-heating will ensure that the fish mouthing of the tunnel doesn't occur, and you don't need to hydrate the tunnel at the end of surgery. Thank you.